As part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight, must quarantine immediately. Amid all of this difficulty, the great hope for 2021 is, of course, the vaccine. The vaccine is our route out of all this. And however tough this Christmas and this winter is going to be, we know that the transforming force of science is helping to find a way through. I'm delighted to be able to tell you that the Oxford AstraZeneca vaccine, developed here in the UK, has submitted its full data package to the MHRA for approval. This is the next step towards a decision on the deployment of the vaccine, which is already being manufactured, including here in the UK.
New analysis has confirmed that the new variant of coronavirus has a much quicker transmission rate than the original strain. Researchers at Imperial College London say that even with a lockdown similar to that in England in November, the number of cases would still triple, and that this was the most serious change in the virus that we've seen. It comes as the government reported another 53,285 new infections. The surge in cases, particularly in London and the South East, has left NHS emergency staff at battle stations, according to medical leaders, with health workers exhausted and struggling to cope. Our health correspondent Dominic Hughes reports.
It might be a new year, but there's no let-up in the pressure on hospitals in London and the South East. A surge in seriously ill COVID patients means staff are being pushed to the limit. Intensive care beds are a real pinch point. Some patients have been moved from Kent to Bristol and Plymouth, where there's spare capacity. That in itself is not unheard of, but doctors say it shows the pressures they're working under.
If the number of cases don't begin to reduce fairly soon and indeed reduce sharply, we would be in a situation where the healthcare infrastructure, not just in London, but across the entire country, is overwhelmed.
And it's not just rising patient numbers. Staff themselves are falling ill, meaning resources are getting stretched.
Everybody's reporting a lot of pressure. Everybody is saying that it's really difficult to offload ambulances because our departments are full, because in turn our hospitals are full. It's very frustrating because you can't look after patients in the way you want to. And you feel helpless when you know that there's a sick patient in an ambulance which you just can't get into a department because there isn't space.
In order to provide some relief, the Nightingale Hospital in London is being made ready for non-COVID patients. But still, hospitals report the situation remains very difficult.
When we are seeing major London trusts, as we've seen in the media today, basically saying that they are under real pressure, they are at more than double the normal rate of ICU admissions than they would see. They are turning whole floors into additional ICU space. That's when we know we're in a very, very challenging place.
This surge in patient numbers is being driven by the new variant of the coronavirus. It's more contagious and it's affecting more younger people. And it's having an impact not just on hospitals in London and the South East, but right across the country. And new research highlights the impact the new variant of the virus is having on the R number, the rate at which it spreads.
Under the lockdown, maybe over the course of 2 to 3 weeks, the cases would have decreased by something like 30%. But if the new variant is now present, with this increase in the R number, all of a sudden, instead of a decrease of 30%, we get a massive increase. The number of cases over the same period could triple. So this is more or less the most serious change in the virus that we've seen since the epidemic began.
The best defence against the virus remains maintaining social distance, good hand hygiene and wearing face coverings. But the big concern is that as this new variant spreads, the extreme pressures now evident in London and the South East will soon be seen across the country.
Dominic is in Salford for us now. Dominic, just as you were saying there, really, this new variant is really putting serious strain on the NHS.
Yes, Rita, I mean, tonight we're seeing a real contrast, aren't we? That optimism around the vaccine that we've enjoyed for the last couple of weeks, and that remains our chance of getting out of this dreadful situation in which we find ourselves. And yet, at the same time, the health service is braced for what we're told will be a nail-biting few weeks. And the reason for that is there are now hundreds of thousands of people in the UK who are infected with the coronavirus, and sadly, some of them will need hospital treatment. They will become very ill and will need that hospital care. And yet hospitals are struggling not just with rising patient numbers, but with staff sickness. Staff are also exhausted. They've been doing this for months now. So we know that hospital cases have been rising here in Greater Manchester as well. A doctor told me that after a very busy October and November, they had a quiet few weeks at the beginning of December, and now those cases are rising once again. So the great fear is that what is happening in London and the South East will now spread to the rest of the country, driven by this new strain of the virus that does appear to be much more contagious.